Yes.
Hello, my name is Althea, and I'll be your student nurse today with Kaiser University. I'm here today to do a full physical assessment of you. Okay, and before I begin, let me go ahead and provide privacy. Okay, I have already performed hand hygiene and donned my gloves, my PPE. Okay, and before I proceed, can you state your name and date of birth?
Roger Plummer, November 6, 1982.
Excellent, thank you. I have verified two identifiers, name and date of birth. Now, Mr. Plummer, would you like me to call you Mr. Plummer or Roger?
Mr. Plummer is fine.
Okay, do you have any pain on a scale of 0 to 10, with 0 being no pain, 10 being the worst pain you've ever felt? Do you have any pain?
No pain.
Okay, do you have any allergies to latex, food, or medication?
No allergies.
Okay, excellent. I have noted that the posture is erect. The patient's height and weight are within proportion to the patient's stature. The patient is appropriately dressed for the season. It's well groomed. The patient appears to be in good spirits, happy by the facial expression. Do you have any assisted devices? Can you ambulate? Do you wear glasses?
No, I believe fine.
Okay, no ambulation devices noted. The patient is able to ambulate without devices. Do you wear any hearing aids?
No.
Okay, the patient does not need any use of a hearing aid or vision aid. Okay, now I'm going to raise the bed up to a good working height for my body mechanics, and I will lower the rail for patient safety. Okay, now I am going to begin your assessment, and what I will be asking first of all, I need to verify the patient's level of consciousness. Mr. Plummer, do you know where you are?
Yes.
Can you tell me where you are?
In the hospital.
Can you tell me what year it is?
2020.
Can you tell me who the president is?
Donald Trump.
And can you tell me what day of the month, the week it is, sorry?
The day of the week?
Yes.
Today's Monday.
Excellent. The patient is awake, alert, and oriented times 4. Now, Mr. Plummer, I will be doing also assessment of your remote and recall memory. I'll tell you 4 words, and I will need you to remember them. Boy, girl, mom, dad. Okay? I will be asking you those words at some point throughout the physical assessment, and I will need for you to remember those. Okay? I have already assessed the patient's vital signs, and they have been documented as within normal range for the male adult. They included blood pressure, temperature, respirations, O2 saturations, and pulse rate. And that has been documented. Okay, I'm going to go ahead and begin your physical assessment, starting from the head and working my way down to the lower extremities. Okay, I have assessed the patient's head is round, normal cephalic, symmetric, face is symmetric. Okay, and I'm going to assess the hair. Okay, I'm checking the hair is shiny, full, evenly distributed. The head is round, smooth, no bumps or lumps felt. Any tenderness? Okay, excellent. No alopecia. No balding, no infestation noted. Okay, I will also assess the patient's facial hair. Okay, eyebrows are even, full, bilaterally. They're both symmetric. No infestations noted. No hair loss. Eyebrows, normal curvature, full, no infestations noted on both eyes, and both eyes are equal on left and right bilaterally. Okay, and the next thing I will be assessing is your vision. Okay, for this vision test, I will be shining a light in your eyes, okay, to check your pupils, and I will give you a couple instructions for you to follow. Okay, I'll be pulling down your eyelids. I have observed no drooping on the eyelids, lower lids, no drooping, symmetrical. Okay, so I'm checking for the conjunctiva. They're pink, moist, up. Okay, excellent. And the sclera is white. And so the patient's eyes are normal, no lumps, bumps, no lesions, no redness noted. Okay, and with my pen light, I will assess the pupils. Okay, pupils are equally round, both left and right bilaterally. Okay, so if you look straight ahead for me, Mr. Plummer, I'm going to be shining the light in your eyes to check the reaction of your pupils. Okay, excellent. And continue. Look at the pen, and I'll be assessing your cranial nerve number 3, cranial nerve number 6, and cranial nerve number 4. Okay. Excellent. I have verified Perla. The patient's pupils are equally round. They react to light and are accommodating. So I have verified cranial nerve number 3, ocular motor, is intact. Cranial nerve number 4, trochlear, is intact. And cranial nerve number 6, abducens, is intact. Okay, I will now be assessing your nose. Okay, I'm going to palpate. Any tenderness?
No.
Pain? Okay, no lumps or bumps felt. The septum is not deviated, it is straight, and the nares are equal bilaterally. They're both symmetric. Okay, and I will be looking in your nares. Hold your head back. Okay, inside the nares are moist, pink, no drainage or blockage, obstruction of airway noted. Can you go ahead and hold one side and blow? Okay, hold the other side, blow for me. Excellent. So the patient's nares and nose is in good shape. Okay, now I need you to close your eyes for me and keep them closed until I tell you. I will be assessing the patient's cranial nerve number 1, the olfactory. Okay, I'm going to place something under your nose and I want you to tell me, what do you smell?
Coffee.
Excellent. You can open your eyes. So cranial nerve number 1, olfactory, is intact. Okay, now I do have a Rosenberg chart that I'm going to be using to also assess your vision. Okay, and I'm going to be holding it 12 inches. I want you to tell me, cover one eye. Tell me, can you see this line?
Yes.
This line?
Yes.
This line?
Yes.
Excellent. Same thing for the other eye. This line?
Mm-hmm.
This line? This line?
Mm-hmm.
How about this line? Okay, excellent. On the Rosenbaum chart, the patient is 20/20 vision. Okay, and we'll have a Snellen chart, which is a farther distance away. That's also will be testing your vision. So if you could do the same thing, cover one eye. Okay, read the chart for me. Can you read this line?
Yes.
This line? This line, excellent. Same thing with the other eye. How about this?
Mm-hmm.
This line?
Yes.
This line?
Mm-hmm.
Excellent. So the patient, I have observed the patient's optic nerve, cranial nerve number 2, optic nerve is also intact. Okay, and now we'll be assessing the patient's oral mucosa. Okay, again with my pen light. Go ahead and open for me. Okay, lift your tongue. Okay, tongue is pink, moist. No dental caries noted. no scleration, no lesions noted in the mouth. I will also be checking and assessing the patient's gag reflex. Okay, I'm going to be putting this on your tongue, and I have to check on this. Okay. Okay. Pink, moist. Okay.
Yes. You got it.
Okay. Okay, so I have assessed the patient's cranial nerve number 9. The glossopharyngeal is intact. And can you stick your tongue out for me and move side to side? Perfect. Patient's chin is symmetrical. Okay, and can you swallow? Okay, so I have observed that cranial nerve number 12, the hypoglossal nerve, is intact, and cranial nerve number 9, glossopharyngeal, is also intact. Okay, can you bite down just like you're chewing on gum? You don't have to show your teeth, just bite down. Okay, I'm feeling the masseter muscle. Okay, nice and strong. Okay, so cranial nerve number 5, trigeminal nerve, is intact. Okay, I will now assess the patient's hearing, and I'll be doing several tests. Okay, the first one I'll be assessing, I'll be palpating the ears. Do you feel any pain or tenderness?
No.
Okay, I'm checking behind the ears for any break in skin, any tears, redness. Okay. Pain or tenderness. Okay. No bumps or lumps felt. The patient's ears are symmetric, equal bilaterally. Okay. And I'll be using my otoscope to check the ear. Okay, and I've observed the shiny and round with the otoscope, and also with the pen light, no drainage noted. I will now be checking the cranial nerve number 8 and assessing the patient by using a whisper test. So I'm going to cover your ear and whisper, and you tell me if you hear something.
Yes.
Okay, you hear that? Okay, I'll do the same thing for the other ear.
Yes.
Okay, I have observed that the patient's cranial nerve number 8, vestibular cochlear, is intact. Okay, so I'm also going to be doing the RIN test to check for hearing. Okay, and this is going to ring, and I'll place it on the top of your head. It should vibrate. Let me know if you hear it.
Yes.
Tell me when it stops.
Stop.
Perfect. You hear it in both ears?
Yes.
Okay. Hearing is equal bilaterally. I'm going to be checking the bone conduction against the air conduction. Put it behind your ear. Can you tell me if you hear it? You should hear it.
Yes.
Did it stop?
No.
Okay, let me know when it
It
stops.
stopped.
Okay, do you hear it now?
Yes.
Excellent. Okay, I'll be doing the same thing with the other ear. Let me know when the ringing stops.
Stopped.
Okay. Do you hear it?
Yes.
Okay, so I have verified that the patient's air conduction is greater than the bone conduction. And okay, now I'm going to assess and palpate the sinuses. Okay. Any pain, tenderness? Excellent. Okay, I will also assess the patient's temporal artery. Okay, bilaterally, 3+ bilaterally, and regular on both sides. I will assess the patient's lymph nodes. Okay, beginning with the preauricular on the front of the ear, post-auricular, submental, submandibular, just the digicular, okay, deep cervical, anterior cervical, supraclavicular, subclavicular, postclavicular, okay, and I have observed that none of the lymph nodes are palpable, and that is within normal limits. Okay, so I am going to now assess your carotid pulse on both sides. I will do each individually, okay, beginning with the left side. My right, patient left. Okay. Excellent. And the carotid pulse are felt 3+ bilaterally on both sides. Nice and strong movement. I will also assess the neck, any pain or tenderness. Okay. No lumps or bumps felt or detected. Okay, now the last nerve that I will be assessing is the accessory muscle. Okay, so I'm gonna have you turn to your face to the side against resistance. Okay, the other side. Okay, and then he's gonna shrug your shoulders for me. Shrug. Okay, excellent. So I have observed that cranial nerve number 11, accessory muscle, is intact. Okay, and
Is there any structures in my neck that I need to know about? Or any?
You can't ask me that.
No?
You can't ask me that.
Okay.
Okay, I'll be using the bell of my diaphragm to check the patient's carotid pulse, to listen for any abnormal sounds or bruit. Okay, I'll be doing that on both sides. Okay, and I have observed no bruit, clear sounds on the carotid. Okay, and they're equal bilaterally. Okay, you turn your head to the right. Okay, no JVD, jugular vein distension. Other side. Okay, no JVD, jugular vein distended on either side. Okay, so I'm going to be moving down to your lungs. Now, if you do not mind, could you stand for me? Okay, and turn your back to me. This way. Okay, I will be assessing, checking the patient's shoulders and hips are symmetric and in line evenly, and I'll be checking the patient's diaphragmatic symmetry. Okay, so if you go ahead for me and breathe in and out. Okay, so the patient's diaphragmatic rise is equal bilaterally, posterior on left and right sides. They rise and fall equally with each breath, inhalation and expiration. I'll be also assessing the patient's breath lung sounds, beginning with the using the diaphragm. Okay, breathe in. Breathe in. Breathe in. Breathe in. Breathe in. In. Breathe in. And in and out. Okay, so lung sounds are clear bilaterally posterior on the patient's lungs. I'll also be assessing the patient for firmicutes. Okay, can you go ahead and repeat for me 99?
99,
99,
99,
99.
99.
Okay, and so firmicutes is present. Could you go ahead and turn for me? And can you recall those 4 words that I told you earlier?
Mm-hmm.
Okay, go ahead.
Boy, girl, mom, dad.
Okay, patient's recall is intact, recall memory, and you can sit if you would like. I'll be assessing the patient's lung sounds anteriorly. Okay, and I've assessed the patient's chest. It is symmetric, both sides. No pigeon chest or barrel chest noted. No abnormalities noted on the patient's chest area. Breathe in and out. In. And out. Breathe in and out. And breathe in and out. Breathe in and out. Okay. Excellent. I've notated no labored breathing, and the patient's lung sounds are clear, bilaterally clear resonance, no hyperresonance or hyporesonance noted. Okay, now I will be percussing the lobe of your lung. Okay. No abnormal sounds heard on percussion. And now I will move to the cardiac landmarks. So I'll be assessing the aortic, the pulmonary, tricuspid, Ernst point, mitral, and apical pulses. Okay? So if you can lay back for me, or you can sit, it's fine. Okay, so mid-clavicular line, we go to the second intercostal space for the aortic pulse, and that's on the right side of the patient. Okay, and we listen. Okay, the second intercostal on the left. Third intercostal. Ernst point. Okay, in the mitral. Okay, and we'll be assessing the apical pulse for 60 full minutes, 60 seconds. Okay, we assess the apical pulse, which is found at the 5th intercostal space, midclavicular, for 60 seconds. No galloping noted. S1 and S2 sounds are noted. No abnormal sounds detected. Okay, so we're going to go ahead now to the abdominal quadrant. If you could lay back for me. Okay, so I have assessed on both sides. I have assessed laterally on both sides. The abdominal area is symmetrical. No distension noted. No edema noted. Okay, and I will begin by auscultating the abdominal quadrants, starting with the right lower quadrant to the right upper quadrant, then to the left upper quadrant and left lower quadrant. Okay, and bowel sounds are active in all 4 quadrants. I will now percuss. Okay, and I've percussed and no abnormal sounds heard on percussion. I will now be palpating and checking for liver dimensions. Any pain, tenderness? Any pain or tenderness?
No.
Any pain?
No.
Tenderness?
No.
Okay. Patient's liver dimensions are within normal limits for the average adult. And while I'm here, I will go ahead and assess the femoral artery on both sides. Femoral arteries have been noted, 3+ and strong. Okay, and I will listen now to the aortic pulse using the bell of the diaphragm. Okay, aortic, no bruit noted. Okay, you can go ahead and sit up for me, Mr. Plummer. We're almost through. Okay, and I'm observing the patient's skin. It's moist, clean, dry to the touch, and minimal hair, evenly distributed. No clubbing detected on fingers. Capillary refill is less than 3 seconds. Capillary refill, no clubbing detected on the feet, less than 3 seconds. Okay, and I'm going to assess the popliteal pulse behind the knees. Okay, I've assessed popliteal pulse as present, 3+ and strong on bilaterally, both sides of the patient. The dorsalis pedalis, I'll assess those, 3+ strong bilaterally. Posterior tibialis, okay, 3+ strong bilaterally. Okay, and I'll assess the patient's radial arteries. Okay, nice, 3+ strong bilaterally, and the brachial. 3+ strong bilaterally. Patient's skin has no scoriations, no edema, no bumps, no rashes. Excellent. Okay, and the patient's skin turgor, if I feel above the clavicle, excellent skin turgor noted. Okay, and we'll now assess your balance and coordination. So if you could stand for me. Okay, can you touch my finger? Touch your nose. Touch your other hand. Okay, touch your nose. Okay, lift your arms out to the side, up over your head, small circles to your side. Okay, bend over, touch your toes. Okay, stand up. Okay, so the patient has normal range of motion with no assistive devices, is able to bend over, touch his toes, touch his nose, follow directions. For the balance, now if you can go ahead and in a straight line, make 4 steps forward for me. Okay, and back. Excellent. And patient is coordinated and balanced. Okay, and I have assessed the pulse, I have assessed the patient's height, weight, body proportion is within normal limits. Okay, turn. Okay, excellent, and turn. Okay, and can you now tell me the 4 words can you recall the 4 words that I gave you at the beginning of the assessment?
Boy, girl, mom, dad.
Excellent. The patient's recall and long-term memory is intact. Okay, so Mr. Plummer, you can sit as this. Okay, and this will now conclude our physical assessment today. And I will go ahead and document all relevant findings and data in our system. And I thank you for being a good sport, Mr. Plummer. And I hope you have a wonderful day.
Thank you.
You're welcome.